Okay, so let's say you have a patient who's got a blood pressure of 132/83. Should you treat that patient right off the bat? Or do you want to wait and reassess? Well, what you want to do is you want to calculate their risk score for heart disease. And based on that risk score, you can decide whether you want to treat them right off the bat now or wait and try to influence that blood pressure with lifestyle changes and then reassess. So the recommendation is if you first use you have a choice of either the ASCVD risk calculator or the PREVENT risk calculator, which is thought to more accurately assess risk. That just came out in 2024. And based on that risk score, if it's over 10%, you should opt to treat that blood pressure. If it's under 10%, you can wait and you got a little bit more time. You want to reassess and encourage those lifestyle changes and then decide if they should be treated after a 3 to 6 month period. And then from there, you can decide which route you want to go.